Well, yes, this is how I left off on the week 10 lecture. However, there were some review questions that I didn't get in, and it was getting rather long, so I thought I would record that separately. So here we go. Review questions. All right. In lecture, what was your instructor's favorite method to control microbes on hands? Which one do you think that would be? Clearly, soap and water. Alcohol-based hand sanitizers are just goo. And again, what does alcohol do to an endospore former? Nothing. So the next time you're dealing with your patients and taking into consideration something like C. diff, Clostridium difficile, an endospore former, just know that harsh language is just about as effective as Purell. So it would probably be better you just, well, you can put it on your hands, but then wipe it off with a paper towel. Okay, so a brief heat treatment that reduces the number of spoilage organisms and destroys the pathogens. Okay, it can be used on foods or inanimate objects. Autoclaving, pasteurization, disinfecting, freezing, microbial control by harsh language. Yeah, that would be pasteurization. Again, you don't need to kill everything. You just need to reduce the numbers, get rid of spoilage organisms, and maybe get rid of the pathogens. Okay. Of all the things we've talked about in microbiology, what is the hardest living thing to kill and why sterilization is challenging? Gram-positive bacteria, gram-negative bacteria, pollen, endospores, or viruses? Once again, endospores, like what Clostridium difficile would make, or Bacillus anthracis, or Clostridium perfringens, or Clostridium botulinum, or any of those. Okay? Right. And remember, this is the hardest living thing to kill. If we were talking about infectious things, prions are right up there. Of all the physical control methods we talked about, which one works as the best and most reliable sterilizer? Autoclaving, desiccation, freezing, washing, verbal abuse. Desiccation is drying things out. Okay. But no matter what, autoclaving is always the most reliable way to sterilize because you're adding pressure with steam and you can get the temperature above boiling. So above 100 degrees Celsius. How far above? About 120-ish degrees Celsius. Yay. Okay, this kills or removes all infectious agents. Disinfection, disinfection, pasteurization, sterilization, sanitization, or do you like A and B? Yeah, that's sterilization, right? A bacteriostatic agent. A kills spore-forming and vegetative bacteria. B kills only bacterial spores. C keeps bacteria from reproducing. D keeps viruses from reproducing. E kills all types of germs. Well, it's bacteriocidal but static, so keeps bacteria from reproducing. That would be C. Okay. Which of the following agents will not kill bacterial endospores? A, ethylene oxide, B, aldehyde, C, alcohol, D, iodine, E, hypochlorite bleach, like Clorox bleach. That would be C, alcohol. How does an autoclave sterilize? A, high pressure causes cells to explode. B, pressure produces free radicals. C, pressure cross-links thymines. D, pressure allows water to boil above 100 degrees Celsius. E, pressure cross-links all proteins. Well, we already said that pressure allows water to boil above 100 degrees Celsius. So that is D. Now, what produces free radicals? Well, we talked about, well, we did talk about hydrogen peroxide will do that. Ethylene oxide explodes, but that's about it. and UV light will cross-link thymines in DNA. So there you go. What is the active ingredient in triclosan and in the old-fashioned stinky brown bottle of Lysol? A, phenols, B, chlorhexidine, C, quaternary ammonium compounds, D, ethylene oxide, E, aldehydes. Well, that's a phenol. That's A. Yes. This chemical is an overused phenol for hand sanitizers and is known to disrupt estrogen levels in laboratory animals, inhibiting normal fetal development. A, triclosan, B, hydrogen peroxide, C, chlorhexidine, D, hypochlorite, E, aldehydes. That would be triclosan. All those chemicals that say antibacterial, not all of them, but a lot of them say triclosan, which are being banned now finally, but not across the board. What is the active ingredient of Hibiclens, which disrupts membranes? A, phenols, B, chlorhexidine, C, quaternary ammonium compounds, D, ethylene oxides, or E, aldehydes. This one is B, chlorhexidine. Yes. Uh, Sometimes they put that in chlorhexidine is in surgical scrubs, but the Hibiclens is what you use when you're about to have a surgery, right? What your patient has to bathe in. What is the definition of asepsis? A, sterilization of an area. B, the absence of significant contamination. C, controlled heating below boiling temperatures. D, physically removing organisms. E, microorganism population reduced to a safe level, judged by public health standards. That would be B, the absence of significant contamination, right? Used in labs, counting rooms of pharmacies, packaging, that sort of thing. Why do we keep Clorox bleach and iodine capped and protected from sunlight? A, they are explosive. B, they become inactivated in sunlight and air. C, the volatile gas fumes cause cancer. D, they become more toxic in animal tissues when exposed to light. E, they jump out of the bottle and attack your clothing, specifically black clothing, I must add. Okay, we'll leave that one out. They become inactivated in sunlight and air. So if you have some old bottles of iodine, you pretty much need to toss it. If you have some old bottles of Clorox, you've used a little bit at a time, it's been open, maybe, wash that down a drain or a garbage disposal, I can talk, and it will freshen and clean things up for you. So, gonna stop there. Though those were just a few. So again, if you have any questions, give me a holler. Thanks a lot.